Welcome to Doctor's Diaries at RxJX Samanvai. I'm your host Joy. I'll be discussing various topics with various doctors throughout this series. Today, we will be speaking to Dr. Jyotika Gupta, family medicine specialist and diabetologist at RxJX Samanvai, Malaysia. She'll be explaining a bit about dengue and how to look for the various symptoms. Welcome, Dr. Jyoti. So, what is dengue fever and how is it transmitted?
Dengue fever is a virus that affects the liver. It's a mosquito-borne infection. As against, dawn and dusk when we have to take care, we should be careful in the daytime also. And these mosquitoes breed on stagnant water. So that is what we have to be aware about.
What are the usual symptoms of dengue fever?
So as you must have seen, dengue usually starts with a fever, a headache, a typical pain behind the eyes, loss of appetite, some rashes on the body, and nausea, vomiting. So this is what it starts with, the early phase. Later it may get more severe.
So you're saying that we need to look at these symptoms.
Yes.
We need to carefully look for these symptoms.
And visit your doctor at this time and then see how it goes ahead.
Usually when we have a small fever, we usually don't visit a doctor. When do you think it gets serious and we have to seriously go and get an admission?
Yes, so since we know it's the monsoon, water may be stagnant all over, in our community, playgrounds, terraces, gardens. And at this time, if we do get these symptoms, keep in mind that it could be dengue also and visit your doctor. But yes, you also asked me about worsening of symptoms. So if these symptoms extend and you have, unstoppable vomiting, headache, loss of appetite, fall in blood pressure, bleeding from gums, nose, bleeding in the urine, in stools, and women may have heavier menstrual cycles, so that becomes a red flag.
We need to avoid these red flags.
Yes, and immediately meet your doctor. That's when we will decide about doing your blood tests. So most people are already aware about the platelet count and all that. But what is equally important is your hydration.
Typically, how long does an average dengue illness last?
Yeah, so usually it has three phases. One is the acute fever phase, so wherein it may be about 2 to 7 days. You may have the usual symptoms that I mentioned to you, fever, headache, nausea, and feeling lethargic and tired. After this, it may get into what is called the hemorrhagic phase, when the fever comes to normal, but the platelets start dropping. And at the same time, you may feel very sick. You will not be able to eat anything. There may be persistent vomiting. And if the platelet drops to a low level, you may have these episodes of bleeding. Third comes the recovery phase, when the virus itself starts getting eliminated from the body and platelets start getting back to normal. So three phases, like I said, the febrile phase or the fever phase, then the hemorrhagic phase when the platelets may drop, third is the recovery phase.
What is the usual treatment of dengue fever?
Very good question. No antibiotics, no steroids. The mainstay of treatment is paracetamol for your fever and headache. Good hydration. Please mark this in bold. Hydration is the mainstay of treatment in dengue fever and for that matter any other viral fever. Eat well, take good rest, take symptomatic treatment, and most people will recover on their own without needing admission.
So in essence, we should eat well, rest well, and drink a lot of water.
Yes.
And avoid steroids.
Completely. Avoid antibiotics.
Antibiotics.
Yes.
We keep hearing this grandmother's treatment. Eat a lot of papaya leaves. Eat papaya juice, which is really horrible. And also eat kiwi fruits. Do they hold any value? Or is there any medical reason for that?
So honestly speaking, there is no medical evidence for this that really it is going to elevate your platelet count. But having fruits is definitely advised. You don't have to restrict only to dragon fruit or kiwi fruit. Have all fruits in moderation. And I don't know if you've ever tasted the papaya leaf juice. It's really bitter. And we have had patients coming back to us with severe vomiting and gastritis. And it causes even more dehydration and they may go into shock. So please avoid this as much as possible.
As a myth.
Yes.
Dr. Jyotika, we have a lot of questions with regards to platelets and transfusion and all these things. How do we go on?
What we do usually in our practice is, if after 3 to 5 days the patient is still looking sick, we start monitoring the platelets. And a normal platelet count is between 1.5 lakh to 4 lakh. So if your platelet count is dropping, it should be monitored almost every day. The doctor decides that based on the severity of fall. And only when the platelet count has fallen below 15,000 is when we decide about transfusion, or if there is active bleeding somewhere. There are instances wherein even at a count of 50 or 60,000, someone may have bleeding. At that time, we decide about transfusion of platelets.
Prevention is better than cure. How do you think we can prevent pain in the first place?
Like I had mentioned to you that the mosquito breeds in stagnant water. So avoid stagnation of water. In the playgrounds, around our houses, we may have some containers, old discarded items where the water may just collect. So avoid that. And secondly, it's monsoon, it is the mosquito season. Use mosquito repellents, mosquito nets. And third, hydrate yourself well.
So you're telling us that we need to keep our surroundings clean,
Absolutely.
make sure that there's no stagnant water, and also ensure that we eat well and drink a lot of water.
Yes. Correct.
Thank you, Dr. Jyotika, for enlightening us with these few tips.
Thank you for inviting me.